So good afternoon. Thank you for being with me here in the middle of this global pandemic, and thanks to your graduate student leaders who invited me to share today with you. It really is an honor. No, I've been thinking about you all during this time, and I'm here to support you as you take your next steps. I'll have my email address on the last slide if you want to reach out. For those of you who don't know me or didn't have the opportunity to take 832 with me this year, I'm Dr. Heather McCauley, assistant professor in the School of Social Work. I'm wrapping up my 4th year at Michigan State and first in the School of Social Work. For the benefit of those of you who don't know my work, I'll share a little bit about my research as I think it helps you understand where I'm coming from and why I'm so thankful to learn alongside of you all. And then we'll have a conversation about why our world needs leaders like you as you take your next steps. While I won't go too much into detail, I do want to share that my work focuses on sexual violence. So I will be mentioning sexual violence in the first few minutes of our conversation. I moved 9 times as a kid, but spent most of my childhood in upstate New York in a strange and wonderful town called Saratoga Springs. Saratoga rose to prominence in the late 1800s, known for its casinos, the oldest thoroughbred racetrack in the country, and its healing natural mineral waters. This history as a destination for wealthy New Yorkers who wanted to get out of Manhattan shapes my hometown even today. Like many gentrifying cities, Saratoga's history makes income inequality vividly apparent, as over time, families born and raised in this community have been priced out. I traveled north into the Adirondack Mountains to a rural region of the state called the North Country. At the time, healthcare access in the North Country, the poorest region in New York State, was limited, especially for mental health care. Here, I began to think about drivers of health disparities, including economic inequality and education, and my interest in public health began. As a college student, I majored in sociology and focused my interest on gender and sexuality. I had the opportunity to study abroad twice, in Denmark and Thailand. In Denmark, my coursework focused on health policy and intersecting systems like the criminal justice system, and that's a theme in my work today. In Thailand, we focused on the spread of HIV in the context of sex trafficking, meeting with non-governmental organizations who are providing healthcare for survivors of sex trafficking. Racism in this global context was also apparent, with young women from Hill tribe communities placed in more precarious situations compared to their counterparts who were Thai citizens. Although at this time we were still trying to convince the public health community in the United States that violence was a public health issue in and of itself, my experience traveling globally affirmed for me my desire to combine my interest in public health and health disparities and a career aimed at reducing sexual violence. This was only the beginning. I went to graduate school, first to earn a master's degree in global health, which focused largely on policy and leadership, and then a doctoral degree in social epidemiology. Both of these degrees were from Harvard University, where I had the opportunity to study at the School of Public Health, the Law School, and the Kennedy School of Government. I'll spend a little bit more time later describing what this degree in social epidemiology is. If we were face-to-face, I'd make you guess for me. While a graduate student, I had the opportunity to spend time in rural Montana, interviewing healthcare providers about barriers they face speaking with their patients about family violence. I was based at a domestic and sexual violence agency and helped them with whatever they needed, watching children while survivors went to court, supporting survivors as they decided whether to travel the 75 miles to the nearest sexual assault nurse examiner for a forensic exam, helping navigate housing during a crisis in a rural community where having a domestic violence shelter was not safe because everyone knew everyone. Here I learned how vital it was for researchers to partner with community-based agencies to make sure we were asking research questions that actually mattered to them rather than chasing gaps in the literature. And also to help our research impact practice on the ground. Again, this is a theme that appears in my work still today. My time in Montana further elucidated for me the impact that place, for example, whether someone lived in a rural or urban community, mattered for our health. After I completed my training in global health, I joined a research team funded by the United Nations and the US State Department, focused on the health impacts of sex trafficking. This gave me the opportunity to travel back to Thailand and work with some of the very same agencies I had visited as an undergraduate student. Our work also took me to Cambodia, which introduced me to the ways that historical trauma intersects with present-day conditions to exacerbate inequities and harm. It took me to India to evaluate maternal and child health interventions in urban slums, highlighting for me the ways that poverty uniquely impacts women and girls. I was struck during this time how the challenges facing families in these resource-limited global settings mirrored challenges families were facing in rural Montana. My domestic work expanded too, again focusing on clinical spaces. During this time, we were approached by a Boston-based pediatrician and anthropologist, Dr. Elizabeth Miller, who was hearing something in her adolescent patient population. Her clients were describing their partners interfering with their birth control and their condom use, which made them worried they'd get pregnant. I had the opportunity to join Dr. Miller's team and speak with adolescents about what they were experiencing. This work resulted in the first studies in the field on what the field now knows as reproductive coercion, which was recognized by the American Congress of Obstetricians and Gynecologists as a form of violence that providers should assess for in their patient population. Our brief intervention work, in collaboration with Futures Without Violence, a national anti-violence organization based in San Francisco, involved teaching clinicians to talk to their patients about reproductive coercion and making the links, both for clinicians and for patients seeking care, about the links between violence and why they were coming into the health clinic in the first place. These materials have been disseminated in clinical settings nationally, again highlighting the power of working with community-based agencies and policymakers from the very beginning to maximize the impact that our research can make. I've also spent many years focused on understanding how our attitudes about gender and sexuality shape our behavior. In particular, this work has documented that youth who endorse more hyper-masculine attitudes are more likely to perpetrate abusive behavior. And this work has included evaluating a nationally known program, Coaching Boys into Men, which teaches coaches to talk to their athletes about respect and nonviolence. In our intervention studies in California and then in Pittsburgh, we found that boys exposed to the intervention were less likely to perpetrate abusive behavior in their dating relationships. This work has also included using arts-based approaches. So if you're in my classes, you'll see my excitement about using arts-based methods to facilitate these hard conversations with boys about masculinity. So for example, this is a picture here from a project using visual voices, where we gave boys a prompt and asked them to draw, paint, or write in response to prompts, in this case, about what it means to be a man. Now, in collaboration with my research partner, Dr. Joanne Smith-Darden in the MSU School of Social Work, I'm shifting my focus to work to influence gender attitudes in younger youth before they result in gender-based conflicts. Most prevention programs focus on high school or college, and while that work is critically important, we know that it's probably too late, that our attitudes about gender, and consequently, some of these behaviors that lead up to sexual violence perpetration have already begun. So our team is moving earlier in the developmental trajectory. 2012 was a turning point for my career. I was doing analyses on one of our clinic-based data sets and noticed that LGBT women in our sample were more likely to have experienced violence in their intimate relationships compared with heterosexual women. In fact, in this one particular clinic-based sample, 72% of queer women had experienced intimate partner violence, compared with 44% of heterosexual women. This was a moment where data spoke to me. I put my head down on my desk and I cried, embarrassed that my work for so many years had focused on heterosexual cisgender women, and I clearly missed an important line of inquiry. In other words, the staggering disparity served as the impetus for shifting my work to focus largely on populations experiencing marginalization. So what do I mean by that? In my work, I define populations experiencing marginalization as those who are excluded from social, economic, cultural, or political life, and/or those who experience exploitation, inequity, and harm because of discrimination and injustice. This umbrella unites multiple disempowered groups, sexual and gender minorities, people of color, system-involved populations together, who all experience elevated risk for violence victimization and a whole host of other health outcomes. This highlights the social justice lens of my research program. This brings me back to my training as a social epidemiologist. What am I? I think the current crisis helps me explain why my training is so unique. So epidemiologists focus right now on understanding patterns of health at that population level, at that 30,000 foot level. So right now, epidemiologists are helping us understand how many COVID-19 cases there are in the United States and across the globe, and how these numbers have changed over time. So this is critical work. But social epidemiologists can help us understand why African American communities in Detroit are disproportionately impacted by this disease, or why New York City has been ground zero of the epidemic in the United States. Social epidemiologists focus on the social determinants of health and how structural factors like racism, misogyny, homophobia, transphobia, income inequality, etc., shape those patterns of health in a population. And here is one of the many reasons why we are similar. Social workers fundamentally understand how social and structural factors shape health and well-being. And this fundamental understanding is what our leaders need now to address the health disparities that are so prevalent. We're experiencing a moment in history. Our lives will never quite be the same. And while it's difficult to see how our day-to-day routine will change, one thing is for sure. We will need leaders who understand that the ways that social and structural factors have shaped our realities, and leaders who are prepared to center social justice in their work. More specifically, COVID-19 has highlighted the ways that crises exacerbate inequities. In Chicago, for example, recent data suggests that more than half the people who have tested positive for COVID-19 and nearly 3/4 of those who have died are African American, yet they make up less than 1/3 of the city's population. Analyses of billing data suggest that patients are less likely to be tested for COVID-19 if they're African American. The global health community has recommended social distancing to prevent transmission of this incredibly infectious virus. However, social distancing is a privilege. Low-wage essential workers, like those who are bagging our groceries, driving our buses, are disproportionately people of color who can't work from home, do not have paid time off, cannot absorb lost wages, and face potential permanent unemployment. Social distancing is a privilege. While necessary, it's a privilege. But it goes even farther, and it's rooted in racism and historical trauma, as my colleagues from grad school, Dr. Zinzi Bailey and Dr. Sherelle Barber and their colleagues, outline in this important piece that I've linked here on this slide. Black communities bear a greater burden of chronic underlying conditions that have been associated with mortality in this crisis. This was particularly true in the South, a history rooted in the legacy of slavery and Jim Crow. To be clear, these differences are not a result of biological differences among us. Rather, these are manifestations of structural inequalities. Communities of color experience lower rates of health insurance and poorer access to high-quality health care in marginalized, often racially segregated communities. Moreover, they're likely to experience discrimination in the healthcare system. Imagine a scenario, and these scenarios are happening right now, where an overwhelmed system is making life or death decisions about which COVID-19 patient will receive the support of a ventilator. This opens the door for provider implicit bias to have very real consequences for mortality among patients of color. The health of communities of color are further influenced by discriminatory housing practices and years of disinvestment in communities, resulting in less access among Black and Brown communities to green space, clean water, and other factors that help communities social distance. Finally, studies have documented disproportionate contact of Black and Latinx communities with the criminal justice system, which increases risk for COVID-19 because of close shared quarters, structural constraints on hygiene, and the preponderance of underlying health conditions. So understanding all of this is social epidemiology. Understanding all of this is also social work. Another example I'm watching closely as a violence researcher is the elevated risk for domestic violence during this time when we're isolated in our homes. Not only will this physical isolation likely increase survivors' risk for COVID-19, who leave their homes to escape violence, I anticipate this will also result in spikes in associated mental health outcomes, such as depression and post-traumatic stress disorder, among survivors and their children. The world will need social workers to connect survivors to resources, to provide critical mental health care, and to lead agencies who serve survivors with a trauma-informed lens. When this phase of social distancing is over, whether that's next month or next year, we as social workers are prepared with the understanding that health and well-being are not equally distributed in the society as we knew it. So let us strive to ameliorate those disparities with our leadership. Our world needs the leadership that you have been trained to provide. So what is a leader to you? We'd unpack this if we were face to face, and I'm sad that we don't have that opportunity. But I encourage you to pause and take a moment and write down some of the qualities and characteristics that you look for in a leader. How many of you have been told to step down or fall in line because of your relative rank in the food chain? Perceptions that leaders have of your life experience, your age, or because of who you are. I certainly have. My team's recent work on hashtag activism has inspired me to challenge this status quo and what leadership looks like. For those of you not familiar with hashtag activism, communities are using hashtags in online spaces like Twitter to bring together groups around common social justice issues. You're likely familiar with Me Too or Black Lives Matter. We've published our analyses of hashtags such as How I Will Change and Maybe He Doesn't Hit You, finding that such conversations have the power to challenge social norms and create community. But youth in particular, I love this image, and this is just one of many that have showed us the ways that youth are leading these conversations and challenging our leaders. I've seen youth using hashtags like "If I Die in a School Shooting" to challenge gun violence in schools. Through their activism, they're challenging our leaders to envision a different future. They've inspired me to expect more of my leaders and be more for those that I lead. Leadership is at the core of what you learned as a social worker. You likely spent class time focused on models of transformational leadership, styles in which the leader identifies the needed change, creates some sort of vision for change, and inspires and guides others to work towards that change. To be sure, transformation is what is needed in a fractured world. I encourage you to develop your own definition of and preferences of leadership that extend beyond titles and the power structures of the academy or any other organization for that matter. As social workers, you have everything you need to be transformational because your training has been rooted in the values of the profession: service, social justice, dignity and worth of the person, importance of human relationships, integrity, and competence. I know of no other discipline that is fundamentally rooted in principles that everyone shares. Not only is this uniqueness important and interesting, it's a game changer for making actual sustained change in our communities, locally and globally. It's the reason I was so thrilled to join the School of Social Work, and I'm so proud to be one of your colleagues. But let's circle back to where we started. Understanding that while viruses like COVID-19 don't recognize international borders, we simply do not all experience the same level of risk for acquiring the illness or suffering related morbidity and mortality. How are these facts related to the leaders you all are poised to be? This crisis, as it's unfolding, is a direct reflection of leadership, of leaders who codified inequity in our laws and practices, who over time implemented decisions that created disproportionate burden for communities of color or low wealth communities. These are social justice issues, creating a perfect opportunity for us to lean into our dedication as social workers to promote social justice. But what does this mean for leadership? I argue that it's not enough to say you value social justice, but to actually practice social justice leadership in an intentional way. The educational administration literature specifically frames a kind of social justice leadership, which is the exercise of altering inequitable arrangements by actively engaging in reclaiming, appropriating, sustaining, and advancing inherent human rights of equity, equality, and fairness in social, economic, educational, and personal dimensions. Notice that this kind of leadership is not bestowed upon someone because of rank or title, but requires action to make our systems more equitable. Despite my fascination with hashtag activism, I recognize that actively promoting social justice requires more than conversation on social media platforms. Some of my colleagues actually roll their eyes when they refer to what they call slacker activism. Yet these public conversations can importantly empower those who follow you to similarly engage in addressing these issues. It's important for them to know that you, as a leader, care about these issues and are willing to do something about it. Evidence from public school principals suggests that social justice leadership additionally requires one to commit to examining and shaping institutional structures. This means commitment from leaders who are willing to push back against the ways things have always been done. Social justice leadership requires a commitment to learning and growing, providing leadership opportunities for those of you to lead, and a commitment to continually learning yourself. I know right now you're burned out and you're excited for this next phase in your education to be over, but you will never know too much. So be open to continually learning for the rest of your career. Social justice leadership also requires a commitment to building culture and community. And these are the things that we have been trained to do. To be sure, leaders using principles of social justice leadership will face resistance because you will be challenging power structures. Resistance will be driven by privilege, white privilege in particular, as you strive to reduce racial disparities in health and well-being. Leaders with minoritized identities will be doubly burdened with roadblocks because of bias. There's a robust body of literature on the ways that women leaders, and especially women leaders of color, have to work doubly hard for half the credit because of perceptions that leadership comprises qualities that society traditionally ascribes to masculinity and maleness. You will inevitably have to work against the sheer momentum of the status quo. How many of you have heard, this is the way we've always done it, so this is the way we're going to continue? I'm a runner and I participate in a recreational running team. The leader of this team shared recently, it's good to remember that the, quote, way things used to be were familiar, yes, but also flawed. And if nothing is like it used to be, then the future might be something positive that we never imagined. Visualizing the status quo as having momentum has been helpful for me because it reminds me that social justice leadership has to be active and continually moving and growing in order to slow the momentum of the way things have always been done. Finally, leaders using social justice practices may face resistance from models that prioritize technical over moral leadership. Technical leadership could involve bringing talented folks to the table to address a problem, or incentivizing success to help a team work towards a particular metric, like increasing revenue or grant productivity. But these successes will not be sustainable without the moral leadership to entrench equity in the very fabric of who the organization is, how it is structured, and what it does. Why be bold if this work is hard? Friends, we can do hard things, as Brené Brown says. We must do hard things. Because if this crisis has highlighted anything for us, it's that people's lives depend on collective action and leadership. The leaders who have saved lives during this pandemic have admitted they had much to learn, and they've leaned on public health experts to guide their decision-making. These leaders have had to be vulnerable with those they are leading, sharing in the indescribable pain so many families are experiencing. They've had to communicate authentically in the midst of chaos. That's hard. That's being vulnerable. And that's what we need. Leaders have also built support networks to allow themselves to try out their vulnerability and to create space for their people to challenge them when necessary. Surround yourself with people who will challenge you. Be open to your people challenging you. It will make you grow. The literature on social justice highlights the ways that we as leaders must embrace the tension of resistance, as I mentioned earlier. Demonstrating social justice leadership you will enact resistance against historic marginalization. Do you feel comfortable questioning the status quo? It's okay if you're not there yet. It takes practice. So surround yourself with the people who have developed this skill and commit to learning how to use your voice and power, because you do have power for good. Here, I'm especially challenging those of us who identify as white to commit to understanding how white privilege shapes us and actively engage in anti-racist practices in our lives and our work. I recommend Dr. Kendi's book, How to Be an Anti-Racist, which, similar to social justice leadership, highlights the ways that addressing racism is a continual and active practice. The second kind of resistance you must become comfortable with is the resistance you will face because of your social justice agenda, which I highlighted in the previous slide. In those moments, stay close to your values as a social worker and use them as a lens through which decision-making is filtered. Remember, this is one of the only disciplines where all of you have this shared understanding. Use those values to filter your decisions. A third form of resistance is that which you develop over time in the face of criticism and the pressure of making decisions that shape people's lives. The resistance that helps you sustain. I hope each one of you lean on one another and continue to learn from one another as you move forward. Your shared experience here at MSU School of Social Work, the relationships you've built, this is powerful. Leverage that power. You've heard me say today that social justice leadership is messy and hard and requires you to work at it every day. I know in this moment you hope your learning is done forever, but I'm pleading for you to be courageous. Embrace your responsibility as a leader to open yourself up to growing and being vulnerable for the sake of challenging the status quo. You will need to be committed and persistent, reflective, inclusive, and caring. When you think you're there, know that you're not, and persist. I recommend a conceptual model outlined by Furman to illustrate social justice leadership as praxis. I will briefly walk you through it here. First, you must look inward. Continually explore your values, your assumptions, and biases in regard to race, class, language, sexual orientation, etc. And importantly, how these biases affect your leadership. I shared a little bit about where I grew up and how that shaped my interest in health disparities on purpose. I encourage you to draft a similar reflection and think about where your attitudes came from and how who you are and what you have experienced have shaped how you move through the world. In the diversity, equity, and respect work group I participated this year in the school, we called out the fact that we cannot assume that we all share the same level of self-awareness about how our biases manifest, even if we share the same code of ethics. So how do we explore our biases? Consider a structured self-reflection exercise or journaling practice, exploring your identities or critical life events and how they shape your leadership. Importantly, action in this personal dimension requires acting on this critical self-reflection to transform yourself as a social justice leader. So this journaling process can also include a leadership plan. In this personal domain, commit to continual transformation. The interpersonal dimension reflects the pivotal role of relationships in social justice work. Again, this is what you've been trained uniquely to do. Central to this domain is the ability of a leader to build trusting relationships with those that they lead and create space for voices to be heard. Praxis in this dimension first involves your own self-reflection as a leader with regard to how you communicate and interact with others, including how your style or behaviors affect and possibly contribute to silencing or marginalizing others. This can be really hard, painful work, but it's important for every leader to do this. Your own self-reflection can be bolstered by knowledge from others and what we know from research. Action at this interpersonal level involves the proactive practice of interpersonal relationships based in respect and caring, active listening, and clear communication. Again, this is what you have been trained to do as social workers. Thus, praxis at the interpersonal level requires both a philosophy of respectful, caring interpersonal relationships and the practice of interpersonal relationships that brings your philosophy to life. Again, it's not enough to say you value something. Bring this philosophy to life. Next is the communal dimension, where social justice leaders work to build community across cultural groups through inclusive, democratic practices. To do this, you must develop a deep understanding of the groups that you lead. Again, you have more homework to do as a leader. Action in the communal dimension then involves proactive efforts to establish democratic forums and processes for dialogue and decision-making that are inclusive and include traditionally marginalized groups. Many of the skills developed for action in this dimension are relevant to this work. For example, deep listening, dialogue, cross-cultural communication. But importantly, allow for regular analysis and critique of the structures that you've put in place, and experiment with structural improvements that facilitate more equitable participation in dialogue and decision-making. When you think you're there, no, you're not, and keep moving forward. Praxis in the systemic dimension includes assessing, critiquing, and working to transform the system in the interest of social justice. Such action is broad-ranging and includes prioritizing, working incrementally for meaningful change in the face of that resistance that I talked about and those barriers, and engaging others in this communal or distributed social justice work. While I encourage you as leaders to adopt this social justice leadership philosophy and practice, remember that you're not doing this by yourself. You're doing this as a community, and you can weave some of these values into the work in the community that you're developing together. Developing capacity to do this work as a leader could include targeted reading. Again, your learning is never done. Developing and implementing equity auditing tools, and developing activist action plans based on that equity audit. So try something out, put it into place, evaluate whether it's made a change, and you learn how to do this in program evaluation in my class, and then make changes based on what you found from that audit. Finally, praxis in the ecological dimension involves acting with the knowledge that social justice issues you face as a leader are situated within a broader sociopolitical, economic, and environmental context, and they're interdependent with broader issues of oppression and sustainability. So this is understanding how policies we develop to address an immediate challenge may disproportionately harm communities that have faced generations of discrimination and structural inequality, as we've seen in our global response to COVID-19. As social work leaders practicing social justice leadership, it's our responsibility to challenge dominant narratives of individual behavior or risk by placing our clients' experiences in context. So what kind of leader are you going to be? You have everything you need. Lean into your social work values as you promote social justice, and strive to actually actively engage in social work leadership. Say what you mean clearly and intentionally, and then bring your values to life through committed, collaborative action. Demonstrate courage. We need you. I'll be cheering you on. Thank you.